Thank you to my colleague from Massachusetts who has seen the same tragedy that we are seeing in New Hampshire. And I'm sad to have to come to the floor again today to join my colleagues, Senator Markey, Senator Klobuchar, who have spoken so passionately about our need to address the ongoing heroin and opioid crisis. And like them and many others, I've been coming to the floor for many months to describe the terrible toll that this crisis is taking on communities across the country. I know the president must see it in his home state because it's happening all across America. And it's ironic that we're here during Prescription Opioid and Heroin Epidemic Awareness Week to once again call on this Congress and this Senate to pass emergency funding to address what is the most pervasive, most destructive, and I believe most urgent public health crisis that faces this nation. Now, I certainly don't want to minimize the gravity of the other health challenges that we're facing in America, especially the Zika outbreak, which I believe is absolutely critical. But by any objective measure, these challenges are dwarfed by the destruction and loss of life that is being inflicted every day by the uncontrolled epidemic of heroin and opioid abuse. This epidemic is raging in all 50 states. It is an uncontrolled public health epidemic of staggering dimensions. In 2014, some 47,000 people died from drug overdoses, far more than the number of Americans who died in motor vehicle accidents the same year. And I'm sad to say that New Hampshire is at the epicenter of this epidemic because we have the highest percentage of overdose deaths in the nation. This year, at the rate we are seeing overdose fatalities, we will lose over 500 people in New Hampshire in a state of about 1.3 million. And estimates are that over 100,000 people in New Hampshire have some sort of substance abuse, misuse issue. And the statistics don't even begin to describe the heartbreak and the trauma that's experienced by those who have drug misuse issues and their families. And yet, despite this appalling death toll, despite what the statistics tell us, this Senate has failed to provide emergency funding to first responders, to treatment providers on the front lines of this crisis. In July, Congress passed the Comprehensive Addiction and Recovery Act, CARA, and I applaud Senator Klobuchar and the other sponsors of that legislation. It is a good bipartisan bill. It passed this chamber with overwhelming support. I was a co-sponsor and I voted for it. But as we all know very well, CARA is an authorizing bill. It is not an appropriations bill. The public may not know that because I think there's a lot of confusion about the difference between authorizing and appropriating. But the fact is we know that here in this chamber, that CARA is an authorizing bill and it doesn't provide one penny to fight the opioid epidemic. We need to fund CARA. That probably is not going to happen this year and may not happen for several years. We need to put actual resources behind all of our talk about stemming this crisis. Earlier this year, I introduced emergency funding that would provide an additional $600 million for policing, prevention, treatment, and recovery. I offered this legislation as an amendment to the CARA bill, but sadly it was defeated. And the legislation looks at all of those aspects, prevention, treatment, recovery, policing, because I believe there isn't one magic bullet solution for this issue. We definitely need more treatment. We need to acknowledge that addiction is a disease. That's a critical part of it. But we also need to do the policing, the recovery, the long-term recovery. I was at a recovery center in New Hampshire several weeks ago, and one of the women I met there who was in recovery said, you know, getting clean was easy. It's staying clean that's the hard part. Our nation has addressed other public health crises with emergency funding bills far larger than the one I proposed. In 2014, Congress passed nearly $5.4 billion, billion with a B, in emergency funding to combat the Ebola outbreak in West Africa. And the Ebola outbreak killed one person in America. The heroin and opioid epidemic is killing more than 128 Americans every single day. And we know that treatment is the only effective answer to the addiction. But people are being turned away from treatment due to lack of resources. Nationwide in 2013, nearly 9 out of 10 people needing drug treatment did not receive it. And it's the same story on the law enforcement side of the equation, a chronic lack of resources. As Senator Klobuchar pointed out, and as my colleague from Vermont who just came in Massachusetts understand very clearly, heroin traffickers expressly target rural states and counties where law enforcement is spread too thin and lacks the resources to respond effectively. Meanwhile, as Congress fails to act, the opioid epidemic is on the verge of expanding dramatically. Carfentanil is a synthetic opioid that is used to tranquilize elephants. It's now available on the streets, blamed for a record surge in drug overdoses in the Midwest. Carfentanil is 100 times more potent than fentanyl, which in turn can be up to 50 times more deadly than heroin and is one of the synthetic additives to heroin that is causing so many overdose deaths in New Hampshire. Until recently, Hamilton County, Ohio had 4 to 5 overdoses a day. Now, because of carfentanil, the county is reporting 20, 30, sometimes even 50 overdoses a day, completely overwhelming first responders. Some public health officials say the United States has reached a disastrous inflection point in the opioid epidemic. Going forward, we may be seeing more and more synthetic opioids on the market, cheaper, more potent, more addictive, and even more deadly. So this is just one more wake-up call. As I travel across New Hampshire and talk to Senate colleagues from across the country, again and again, I hear about the lack of resources to marshal an effective, well-coordinated response. And as new and more dangerous synthetic opioids hit the streets, this crisis could become exponentially worse. Our failure to act is having tragic consequences. At long last, let's give law enforcement, let's give treatment providers, let's give recovery centers the resources they so desperately need. At long last, let's come together. Let's pass an emergency funding bill to combat the opioid epidemic. If we can spend billions to fight Ebola on a distant continent, surely we can allocate $600 million to combat a raging epidemic right here at home. Now, when the Senate comes back into session after the election, we will have another opportunity to consider emergency funding to combat this crisis. For tens of thousands of Americans, this is very literally a matter of life and death. So let's put politics aside. Let's do the job the American people sent us here to do. At long last, let's give law enforcement and treatment providers on the front lines the resources they need to effectively address the opioid crisis. Thank you, Mr. President. Thank you to my colleagues from Massachusetts and Minnesota for coming to the floor today to once again point out the need that we so desperately have.